Hi, I'm Dr. Kalika, and today I want to discuss nerve problems. Just about when I started to practice 30 years ago, most of the nerve issues were diagnosed by neurologists using nerve conduction studies, also called electrodiagnostic studies. Today, fortunately, we have modalities that outperform electrodiagnostic studies by far. A new technology recently, high-resolution diagnostic ultrasonography, has completely changed our understanding and our diagnosis of nerve pathology. There's a common umbrella term that's called a pinched nerve. Your nerves can get pinched and trapped, compressed and tensioned. And all this happens for a variety of different reasons. The nerves run in a fascially lined tunnels, and then they pass through a bony prominences, for example, like in the elbow. When you hit and you have that funny bone sensation, that's because you have an older nerve that's come very close to the skin and it lies in the cubital tunnel. We have multiple other scenarios where, unless you use high-resolution diagnostic ultrasonography and you're really skilled in clinical examination with nerve pathologies, you can diagnose nerve pathology along anywhere. MRIs can see nerves, but you cannot really find a problem because the resolution on MRI is not enough. I would say that 30% of our patients come in with complaints of pain somewhere and they don't feel any numbness and tingling. And so they don't know it's a nerve problem, but we relate their pain to certain nerve compression and entrapment. It gets unnoticed by other doctors who are not familiar with the nerve diagnostics. The treatment of pinched nerves really depends on the etiology, the causation. And so depending on what the pathology is, the treatment may vary from using electromagnetic transduction therapy, using extracorporeal shockwave therapy, using hydrodissection through the osteofibrous tunnel or through the fascial lining. If the nerve problem has gone too far, unfortunately, some people require surgery, but I think most patients can be prevented from going to surgery if right modality and right diagnosis is selected. So if you have pain and you think that this may be a nerve problem, or you know it's a nerve problem, but you haven't been able to resolve, please come to our clinic. We'll be able to diagnose you and put you on a road of recovery with getting your nerve back to function.